Nursing is rewarding, important, and often all consuming. And let's face it, it's been a rough couple years. You deserve a laugh. Enter a card game called Nurses Against Insanity, a fun, slightly scandalous take on the work and life of a nursing professional. This game has over 300 cards that we hope will make you and your nursing colleagues laugh hard enough to pee, unless you've been doing your Kegels. Who should play the game? Nursing professionals in any of the various states, such as frustrated, happy, tired, and probably overworked, anyone who's recently had to clean under a funky panis, and everyone who recently thought, I'll have to laugh about this so I don't cry. Visit www.nursesagainst.insanity.com to order the game and use promo code SuccessNP to save 20% off your order. And happy gaming. Attention, all nurse practitioners and NP students. Are you tired of feeling the disconnect between clinical rotations and didactic teaching? Say hello to Success NP's clinical booklet guides.
As NPs ourselves, we know how valuable it is to have a resource that helps bridge the gap between clinical and class. So we created the digital resource to do just that. Our clinical booklets cover 5 major NP tracks: psych, adult, peds, family, and women's health. Success NPs wants to create tools and provide support NPs need to thrive in their careers.
So why wait? Check out our Success NP Etsy shop, linked in the show notes, for our digital guides and other digital clinical resources. Hi, Success MP. This is Sandra. I'm one of the nurse practitioners here at the Success MP podcast. And today we are joined by Lauren Lewis. She obtained a degree in exercise physiology and biology and worked as a wellness coach and an exercise specialist before determining that she wanted to pursue a second degree in nursing. She worked at Duke University Hospital, where she saw the benefits of collaborating between the modern medicine system and a holistic approach. She worked as a nurse until she completed her master's degree and became a certified nurse practitioner. She has been working in a variety of fields, but has most recently landed at the Functional Health Center in Fort Mill, South Carolina, at the Functional Health Center, where she offers affordable primary care and aesthetic treatments to people in the Fort Mills area and the surrounding area at the direct primary care office. So she works there and she provides primary care to the patients at that facility that she owns, which is pretty cool. So I'm super excited to have her on today. Welcome, Lauren, to the podcast. I'm so excited to dive into what you're doing. I kind of introduced your story about you becoming a nurse practitioner and then you opening your own practice. Like, tell us a little bit about that journey from your own lens.
Yeah, so I mean, I everything I feel like completely happened by accident, like all these little happy, lucky accidents, I guess. My God, lost. But yeah, I was working as a nurse practitioner in aesthetics at the time and felt like I was doing a skills-based job. It's great. You get to talk to a lot of women, so you get to learn about other women's health problems other than just their skin and their face. I was speaking with a former colleague of mine who owns the Functional Health Center of the Carolinas. He's a chiropractor by trade, but functional medicine specialist. And he said, there's this thing called direct primary care that I'm really interested in having at my clinic, but I need a nurse practitioner to do it. Do you know anybody that'd be interested? And I was like, well, I could do it. My whole thought process was I would go into this and hire somebody to do it and I would manage it. When I started the DPC, to join his functional medicine, I fell in love with it. I fell in love with the amount of time I get to spend with patients, what I get to do for them, how I get to care for them, how I get to now implement functional medicine into that work. I have not hired anybody. I'm still the provider there because I truly have found the practice that I love.
Okay, so let's talk about that transition because I love to hear that you have found something that lights you up. A
Yeah.
lot of nurse practitioners are in jobs that they feel stuck, that they feel like there's not a lot of options.
Mhm.
And so transitioning from that traditional healthcare system to being on your own, tell me about that process. I know that's not easy.
Well, luckily for me, I had not really worked in any field that was insurance based. So I don't have much to compare it to other than when I was a nurse in the hospital. I remember getting out of nursing school and being like, I need to be in the trenches and I need to be in the hardest floor on the hospital. And I was. And that, then as you get older and life happens, you're like, I really want something that just fits better into my life. And I did find myself in 2 different clinics that were cash-based and didn't deal with insurance at all. That part for me was a pretty easy transition. I don't think you have to be a provider to know that insurance makes insurance companies rich, and many times is not really for the benefit of the patient. You have to jump through a lot of hoops as a provider to even get insurance to approve their medications and things like that. So you're having to constantly jump through hoops and do this, that, and the other. This has been an easy transition for me as a cash-based business, just being able to sit in front of my patient as long as I want to. They can contact me or see me as many times as they want, and I don't have to worry about how I'm gonna bill them or if insurance will let them come back or what I have to bill this appointment as. So that's been a breath of fresh air for I know the people that work with me and our patients as well.
For our listeners that don't know what direct primary care is, that might be a nice refresher to explain what that system looks like. I hear what you're saying. Like, you've never had the insurance world to deal with, so it wasn't much of a transition for you. Maybe describe what it is a little bit so that a nurse practitioner that doesn't know that's even something that we could be involved in. If we're only shown in school that we could only work in these other systems. So it's a kind of a disadvantage to nurse practitioners that never see this other option.
100%. I went to a conference a couple weeks ago that was saying, how do we get more practitioners and PAs involved in direct primary care, not thinking that they have to be in an insurance based world? Direct primary care basically is taking out the middleman, it's taking out insurance. It is a membership based practice. It does not mean it has to be concierge and high price. It just means easy access. So you pay a membership fee. For our clinic, it's $147 a month. With that fee, you get all of your lab work, comprehensive labs, typically what you get at your primary care provider. But I usually do a couple other things like vitamin D, vitamin B, insulin, full thyroid panels, really depending on the patient in front of me. All of that's included. So you pay that fee. You've got the labs included. You've got all your appointments with me included. I see some patients once a year. I talk to some patients twice a week, and that's just the name of the game. But all of that to say it's based on that fee.
They pay this 147 fee. You guys determine this is the fee for patients depending on what these labs are that you're ordering. And then this is the cost to get all those lab work done, the cost to see you, and then your guys are able to still make a profit. Cause I mean, it's a business, you need to make money. And then, so how does it differ from what other benefits that you're noticing for patients? Because that price that you just said, that's an immediate benefit over what I pay for health insurance. I don't know what it is for a family to join your practice, and I don't know if you see children, but that's an immediate savings just to have basic, access to care. Yeah, what if you're noticing is a benefit to patients as far as quality of care, cost, access? What are patients saying?
The first thing patients say is how convenient it is to sit there and, just text you when I need something, right? Because we have that access. We have a patient portal that I check. It comes to my phone like a text message. I check it when I wake up. I check it before I go to bed. And that is really convenient. 8 o'clock at night, you're nauseous, you're going on a trip the next day. You don't have to wait to go to Minute Clinic or urgent care. Your trip's not ruined. You get to talk directly to me. The second thing that people say is cost. I think people see they pay for their insurance and then they're like, "Oh, I can't do 147 a month." What a lot of our patients are doing are switching and they're having a higher deductible, lower monthly premium. I promise I will do the math. It will save you thousands of dollars a year. I mean, my insurance on its own is $340 a month for me. I don't use it for anything. And then if I go to CVS Minute Clinic or urgent care, I still have a bill. I just went to my gynecologist. I got a bill 6 weeks later. You still are paying. Everybody says, "What am I paying for with my insurance?"
Yeah.
At least you know what you're paying for. You're paying for convenience, access, less hassle, better relationship, and you're getting more out of your healthcare.
Yeah, I like that you've cut out this middleman and you can go right up to the provider and get the care you need. It's always inconvenient when you need to go. It's always the day right before a major holiday. And you're
Yes.
like, great, they're never going to get me in. I call my primary. It takes me weeks to get into
Yeah.
my primary
Yeah.
care provider.
Yeah.
And then, of course, then there's something with the kids. I can't go. When you're a busy mom and you're working and you're trying to do all the things,
Yeah.
having to schedule doctor's appointments on top of
And
it.
and I do feel like a lot of moms are just seeing that this is the most convenient thing to do. I mean, we're in a society now where people don't want to come in for everything. Like if you have a UTI, And this is you haven't had a UTI very frequently. You've got burning, you've got frequency, you've got all the symptoms. I don't need to culture it and wait 3 days to get you symptom relief. I can send something in. Same thing for chronic sinus infections. If it's been over 2 weeks and you're hacking, or you've been around somebody with the flu, we can talk, we can have a conversation, and I can get you the medication really quickly.
That's really, really convenient. Well, how do you manage the patient care without the involvement in the insurance companies? I heard you say that you have to push meds through certain medications, you have to bill through the insurance. So are you doing a level of the insurance work? Do you hire someone to do that? Or are you
We
able
don't
to do that work on top of it?
There are a lot of DPC clinics that do hybrid, so they'll do some insurance and some not, and that's usually so they can take Medicare. We don't do insurance at all. The only thing patients use their insurance for is when they go to their pharmacy. They'll present their insurance card and still pay for it. The only thing I ever really deal with insurance is if I have to do a prior authorization, if a medication isn't covered. That's all I deal with insurance.
Gotcha.
Yeah.
All right. So, what does your typical day look like at your practice? Like, what time do you start? Do you have a remote wing to your job? I heard you say you've got some messages coming in. What are some of what does a day in the life of a DPC nurse practitioner look like in practice?
It's pretty nice. I do have the flexibility. I'm not having patients call 3 weeks in advance to book me. Patients just kind of pop up on my schedule as the day goes on. So I usually start around 8:30 in the morning. I'm usually finished around 5. I wake up and kind of leisurely look at my patient portal and see if anybody has a pressing question they need to ask me. I feel like by this point, a lot of my patients and I have a great relationship where they'll just share something with me and it's like texting your friend in the morning. And then I go into work. It really depends. I'd say about 70% of my day is patients in office, some phone calls throughout the day. Some people will call in and message and I'll message them back. But it's not, I know my other friends that work in a traditional primary care setting, it's not like that at all, where you're seeing patients every 20 minutes, you're in, you're out, you're not really getting to talk to them, not really getting to the bottom of their issues. We're able to really look at root cause, which is what functional medicine does as well, and get to the bottom of these. And I think for the most part, our patients stay well because of that.
With functional medicine, the intake is a long process to take you on. And then once you're in, you can manage the issues conservatively. You manage with supplements. It's not just clear cut,
Right.
antibiotics. Don't look at what's going on beneath the surface. I know you're talking about your relationship with your patients and how that's changed over time. What else have you noticed in this space offering more personalized care? What have you noticed for your career that has changed?
I was going to hire somebody to do this and just manage it from afar.
You mean like a nurse practitioner? You were going to find a nurse?
No, I just love the problem solving that comes along with it, the amount of time that I do have to problem solve, the accessibility that I have to my functional medicine provider. She's a nurse practitioner, Chelsea Leveling. She's so smart. She's so involved in patient care. She really wants to get to the root of things, whether it's their gut issues or hormonal issues. I've learned so much from her and from Dr. Reiser, who was my past colleague and the owner of the functional health practice. They do a really good job of not just saying, here's a medication, see us again in 6 weeks. It's like, why is your blood sugar high? What can we do about that? Why do you have Hashimoto's? What can we do about that? And that has really changed me as a practitioner. I'm much more hesitant to just give somebody a medication, ask why a lot more now.
And that's, I think, pivotal part of the scientific method is the asking why. Why? And we've really gotten away from that as providers. We've gotten way more focused in on plug and play, problem fix, problem solve. We are so less focused on why aren't we well? I can just imagine as a patient feeling like not only am I saving probably a ton on health insurance, but also just getting better care because right now the current model is not fit to really give providers time with their patients and to explain things like, you have Hashimoto's, thyroiditis, you just had a baby, especially postpartum for moms. We're just thrown out there, right? There's one 6-week appointment after a baby, and then we never see the doctors again. Figure it out. It doesn't surprise me that women have increased rates of depression and all these different things afterwards. Their guts are a mess. They just had a baby and nobody spends any time with them. And I feel like the functional medicine approach to really get into how are you doing postpartum? How does your thyroid look? All the different things for individualized care and asking the right questions. I think I've noticed a lot in primary care is just lacking. I'm not saying they all feel this way, but I feel like a lot of them kind of just turn and burn.
Yeah.
Okay, all right, you're fine. Okay, go. So
Absolutely. Yeah, it's awful. And then women, I feel like, are made to feel like they're supposed to feel tired. Of course, you got a baby. Of course, you're supposed to feel tired. Your gut's react. That's normal. The amount of times I've heard women come in with labs and they say their provider said this was normal. Like, this is not normal. You don't have to feel like this. You don't have to walk around feeling like this. And, it's a catch-22 for the turn and burn providers of insurance doesn't allow them to spend that amount of time with their patient. They have to see a patient every 20 minutes. It's not a patient-based healthcare system anymore.
yes, I would agree. And that is a pivotal thing to land on is that the healthcare system is not sometimes I feel like it's a little more outcome focused, but I don't really even think that we're meeting outcomes for people because I don't
Yeah.
think people are. I don't know what these in target outcomes are because people along the way aren't feeling better. So it's like,
Mhm.
I don't know if this outcome is really the thing that we should be shooting for. Oh, we need to be shooting for this target hemoglobin A1C. But it's like, yeah, but like that's still not normal. Like having hemoglobin A1C less than 7 still means like you're sick. You should have a hemoglobin A1C really underneath 5. That's really where your hemoglobin A1C should be. But we don't even teach you the things that you need to do to be well to have a hemoglobin A1C of 5. We just tell you the goal is 7, here's some drugs to get you there, and as long as you're there, you're fine, and when you start to really go down the rabbit hole and you start to read, you're like, damage is happening when your blood sugars are above 120. So, we don't talk about those things. Those are only things that you if you're really interested, you find out about.
Yeah.
Diabetes, and so I go down those rabbit holes, and I'm like,
Mhm.
"Wait, I did not know the stuff that I knew now because of
Yeah.
the experience that I had." How do you deal with difficult situations with describing cost to patients and addressing concerns about this model to people that are like, "I don't know if I believe in that." What do you say to those people?
I found that instead of really talking about the cost, patients respond better to the access. They respond better to knowing that no matter what they need from me, they're going to get it. There's no extra fees, no extra billing. I do think patients, for the most part, want somebody they can trust, not just a doc in the box that they go to. I think the majority of people have an issue, an underlying issue that's not been treated. We're just accustomed to living in a body that's uncomfortable for one reason or the other, and we've gotten used to it. I talk to patients about wellness and being proactive with wellness instead of reactive, avoiding sickness instead of having to treat it. So we really focus on that. I feel like our center has really morphed into that wellness center. And so I think the cost is something that most people immediately say, I have insurance, I don't want to pay extra 147 a month. But once they see, you kinda almost have to experience the benefit of being able to text your provider in the morning or being able to get whatever service it is that you need or questions about your health answered, within a couple of hours from the person that takes care of you. I think it speaks for itself. I know DPC practices are picking up all over the place. Practitioners are getting really sick of not being able to practice medicine because of the constraints we're put under. I think that the more places like this that are open, the more people will see it and experience and be able to share that experience with other patients.
Yeah. One of the things I was thinking as you were talking was your access to other things. So I hear you say like, we offer labs. Let's say somebody needs an ultrasound or imaging. You can order those where the patient send them out, get the imaging, follow up, and then refer out to specialists if they need it. Your
Absolutely.
full functioning primary care office, just that monthly fee that's tagged on, but everything else is fully functional
Right. Right.
primary care. Okay.
Yeah, absolutely. There's nothing that a primary care office can do that we can't do.
Yeah. And so we talked a little bit before the podcast about the business side of things, right? So you're a nurse practitioner, you understand all this stuff, how to take care of patients, functional medicine, all that. But then you've got the business part, right? And that's a whole different bird. How do you manage kind of budgeting, marketing, all that stuff on top of seeing patients and taking care of them?
Yeah, luckily, my business partner has taught me a lot about that. He had a lot of experience. This functional health center was open for about 7 years before I joined. He was a guiding light for me for sure. I actually listened to the nurse practitioner in Charleston that does functional wellness and direct primary care. When he first approached me about this, I got on her Facebook group and listened to a couple of her talks. She said, all you need to do is get your LLC, get in a building and get your stethoscope. And it's just you and your personality and your practice. And that's all you need to start. She was right. I didn't listen to her. I bought all the bells and whistles, did everything, but she was right. We recently opened our second location in Charleston, and I listened to her for that. You really just need yourself, your personality, your attentiveness, your care, your follow up, and the people will come. Now, marketing, he already had marketing in place. We split that. We've realized going into Charleston, marketing needs to be a little bit different there. So we're looking at marketing companies right now to help us with that. I think good advice for people trying to do this is have somebody else manage that for you, because it's a lot to take care of 250 patients and do the marketing and the business and payroll and everything. Get support and delegate where you can.
One of the things you're speaking to is freedom and time freedom, right? There's only so much capacity that you have.
Oh, yeah.
I think for business entrepreneurs in the beginning, you just think like there's no money, so I've got to do it all. And sometimes there's a matter of just being like, there's no money, but I need to do what I'm good at and I need someone to do this part. Even if that means you make a little bit less for a little bit of time, it's worth it, because as that person that you hired does what they're supposed to do, you're going to be making more money. Then that begins to pay for itself. You weren't stressed along the way. It's taken me a while in the podcast world and working in our digital business as well. Like, it's super tough to just be like, that's a lot of money to walk out, like to walk out the door, but realizing that turns into more money later. So we've got to just let that go, because we can't do it all. There's only so much bandwidth. So I think that's really good advice. And I think the networking part that one of the things I was thinking when you were talking too was like, how did you find this guy? Hey, I hate to interrupt a good conversation, but I have to tell you about the newest sponsor for the Success NP podcast. Now, do you ever feel like you can't get ahead on charting? Imagine a world where you did not have to think about writing notes again. I want to introduce to you Freed. It is an AI medical scribe built to free clinicians everywhere. It listens, transcribes, and writes instant clinical notes for you in your style. It learns how you like to write notes, and it does it for you. Freed can be used across all specialties and in office, as well as virtual visits, and works in multiple languages. I use it in my current practice, and it is an absolute game changer. I've gotten other NPs to use it as well, and they echo the love for Freed AI. Freed AI is HIPAA compliant and only takes seconds to learn. Over 15,000 clinicians, including doctors, nurse practitioners, therapists, they use it to save up to 2 hours every day to free themselves from documentation. I wouldn't be on here just giving rave reviews if I hadn't tried it myself. It works so well. Start your free trial today. No credit card needed at freed.ai. Use code SuccessNP50 to get 50 off your first month when you subscribe. Now, let's get back to the conversation. So the person that's your business partner and owns a functional medicine practice, like, how did you find him? Were you networking? Did you just have you met him? Because that's kind of a big deal to not have to start it organically, to have someone that's kind of already done the hard startup and you just get to walk into it. And I'm not saying you just walked into it, but to be able to just kind of step alongside and just go like, all right, I'm going to handle this part. You keep doing that. And then you're getting to kind of have some help with the other things, someone to teach you. That's a big deal. I'd probably set up to make less money if I knew that that was going to be a huge benefit and kind of lessen the learning curve for me. Does that make sense?
Yeah, absolutely. It was huge. He and I just happened to work together at our previous job. And so we became really good friends. He was the one that had the idea, and I didn't even know what direct primary care was. There are all these happy little accidents that happened along the way, and I'm just truly grateful for it. The DPC community is extremely helpful. If you want to do DPC, there is a network of providers that just wholeheartedly believe in this. There are forums, there are conferences that will help you get set up. And I really think all it does is take reaching out. You can reach out to me in Charlotte. I just went to a meeting the other day, and it is a very successful DPC clinic They are very big on supporting other DPC practices that are up and coming. There's a woman in Indian Land, South Carolina, which is close to Fort Mill. She does functional medicine as well as direct primary care. And same thing. It's like open door. We want to help people and we only have the capacity to help because I mean, think about it. We don't have thousands of people at our clinic because I spend a lot of time with my patients. So there's a cap on how many people I can see personally.
Yeah.
The more access we can get for patients, the better. It's a supportive community of providers doing this.
So how many patients do you have in your list? So I know like some patients will say like, I had a physician, she worked as concierge medicine and she had a cap. She's like, I only see 40 patients and if each patient's paying me 150 a month,
Yeah.
I mean, this is my salary. It was very easy to see how much money she was making and she was crushing it. She wasn't stressed. Her phone was there. So when people called, she was available to do whatever. But what is your cap? I mean, do you like, I can see 400 or no, I've capped at like 50. Like, what does that look like?
I'm around somewhere between 200 and 250 right now. You have to think about it. You're not, I think Chelsea in functional medicine, she sees people. I mean, she's like doing some really big work, right? In regulating people's thyroids with supplements and lifestyle changes. I'm more of the primary care, see me when you need to see me.
Sure.
So, of those 250 patients, I don't see everybody every week. Some people I see once a year. Some people just have me as that safety net. If they need me, I might hear from them when they need a refill or an annual visit. Of those 250 people, I would say I probably talk to very regularly, maybe 50 to 60 of them. So I really don't know what my cap is. I think that if I wasn't managing it, I could have a much higher cap. I think trying to manage the 2 offices, I'll probably cap out maybe around 300 or so
Gotcha.
because you're not seeing those patients every single day. To your point, it's not stressful for me to check my phone as soon as I wake up at 6 o'clock in the morning or before I go to bed. My cortisol is not high because I don't have that heavy influx of back to back to back patients every day.
One of the things I was thinking, oh, the process. When you have a new patient that comes in, does the other nurse practitioner in functional medicine see them first and then you follow them? Like, all right, you got your initial functional medicine workup and now I follow you for the primary care part? Or are you guys working in conjunction? Do patients bypass her and go straight to you? How does that system flow?
It depends. If they come in just for primary care, they only see me. We do have a lot of patients that say, hey, I'm more holistic minded. I like to be treated holistically, but I don't have any real issues right now. This is just always the type of provider I've seen that they will also see me. Let's say you've been on thyroid medication your whole life, but you are just out of whack. You're chronically fatigued. Your labs look okay, but you don't feel okay. Then you're going to go to Chelsea and we're going to look at your hormones in your gut and maybe see if there's something else going on. Like, do you have mold? Do you have heavy metals? You know, there's so many different things that are not looked at all in Western medicine. It blows my mind. They'll see her. Now, with her care plans, what we usually do is have them be a part of the primary care practice. So they get access to me if they need me for something like that. And our hope is that when she finishes with them, they transition into primary care, which most of them have.
So is the functional medicine part a separate charge or is it all included?
Yeah, it's separate. It's completely separate. There's basically like 2 different departments in our clinic, but we share a lot of the same patients.
That is so cool. Like how you guys have structured this is really neat. Like you're saying, the individualized care, you don't necessarily need to see her always, but for that evaluation to get a really in-depth look, go see her. She'll do that. And then kind of ping pong back over here for your primary care.
Yeah, absolutely. It's not cheap because you're not having to see a functional medicine specialist and then go to your Western medicine primary care and say, I'm on berberine, all these supplements that they do not know about. I think the younger generation of doctors, providers, nurse practitioners, PAs are starting to see the benefits of some herbal supplements. L-theanine is being widely used with ADHD and anxiety, which is something we use very commonly. But I think for the most part, if you see an older generation of practitioners, they're like, that doesn't work. I don't know what that is because they haven't studied it. No, not to be upset with them because they don't it's something that they don't know about, but I do feel like the younger generation is more aware of gut health, full hormone health, etcetera.
Yeah, I think that generation did a good job at creating skeptics than the rest of us. I mean, I was that kid that got told, just get on birth control, you'll be fine, just take it. You don't need to worry about anything. And I just remember trusting. And now I have a chronic health condition from taking birth control because these people were just like, don't worry about it. You don't need to think about it. Just turn your brain off. And
Yeah,
any place that's telling you to turn your brain off as a patient is a problem. Like, you don't need to go there.
absolutely.
Listen, what?
Absolutely.
I'm just like pissed. I'm beyond pissed about it because that's essentially what they do to women.
Yeah.
I think they do that to girls. There's a level of naivete that I had that my mom, kind of was just like the doctor tells you to take it, you take it. And so now I'm a 40, almost 40-year-old female that's just like, why was I asleep at the wheel on my health? And so I think that I get really passionate about this stuff because it really aggravates me. That generation just has this flippancy of just like, trust me because I went and got an MD. I'm like, you don't know everything and not all y'all made straight A's. So just like calm down, explain it to me, spend the time to explain why I need this, what the goals are, what the risks are, and take that time in an appointment. I remember talking to the nurse practitioner who put me on birth control and just being like, I'm kind of afraid of blood clots. And she was just like, you're too much. Take an anxiety pill. You're fine. And I'm like, no, girls were dropping dead of this. They pulled it off the market, the first birth control I was ever on. And I just remember being innately afraid, but not knowing why. And then having somebody completely write me off. And it was a nurse practitioner. I think I was in nursing school when I was going to see her. And so it's just very disappointing that healthcare and medicine has moved that way. But it infuriates me that physicians have used their positions and their knowledge base to just kind of, I don't know what it is to describe what it is that they're doing, but it just doesn't, to just overwhelm you, to just
Yeah.
go like, it doesn't matter. Just turn off your intuition. It's fine. And I think that a lot of patients, especially in this generation, are just like, okay, listen, dude, y'all have done a bang up job. Like, let us maybe take it from a different angle because this is not working. We've never been sicker. And I think it's really neat to hear that nurse practitioners could be a part of that movement. We're patient centered and we can learn this and teach it to patients so that they can take care of their own health.
And it's being proactive instead of reactive. And to your point, it is so frustrating for a patient to be dismissed by somebody that is supposed to be taking care of them. I told a patient this the other day. I think they were seeing a specialist, and the specialist said, yeah, you don't need to take vitamins don't do anything. And I said, well, if you're not getting the vitamins in your diet and you have a vitamin D deficiency, that can screw up everything. As a provider, to pretend like you know everything and to not be curious and inquisitive, we're constantly learning new things every day. And you should be eager to learn that, to apply that to the person sitting in front of you, because that person does trust you. I don't want it to get to a point where people don't trust healthcare anymore. It's becoming that. Patients ask me, we do not push anything on patients. My whole thing when a patient comes in, vaccination status is a huge controversial thing. I will ask the patient if they're vaccinated. I do not push it on them. It is the person sitting in front of me. It is their body. It is what they believe that they want to happen to them. It's not my body. It's not my decision. I can provide education if they ask for it, but even pharmaceutical companies, they're still out there practicing, seeing if things work. It's probably smart, like you said, to be innately afraid of some things. Probably smart to be innately afraid of a vaccine that we see so many side effects and consequences that have happened because it was rushed. I really take into account that person's individual experience and what they want out of their healthcare, and that's how we treat them.
Lauren, we're going down a path, my friend, that I feel pretty strongly about. We are being used to a certain extent. And what you were saying is if you don't like insurance companies, get on the least amount of insurance that you need to protect yourself and go get a healthcare provider that's going to listen to you. Don't just get a healthcare provider that's not going to spend the time with you. Go get one that you can text and message if you want. It just kind of feels like what you're advocating for is liberty. Like, I just want you to be
Yeah.
able to get the information and the care that you need and deserve. Because as American people, we work our whole lives. We pay into these insurance companies for our whole lives. And then when we get to the end of our lives, we're sick, we're tired, and we can't enjoy what we've been spending our whole lives working for. I agree with you. When you see the stats on vaccines as well, it's very concerning that we advocate for these vaccines Everybody needs them. And then we realize like, oh, wait, not everybody needs them. There are actually other things that you can do to boost your immune system from a functional standpoint that can bring about sometimes even just as great benefit as a quote unquote vaccine. And they don't talk about the fact that exercise works just as well to boost your immunity as some of these vaccines. We don't talk about that. I tell my patients in practice now, go for a walk. Going for a walk will do more for your immune system than this pill or that pill. A lot of patients are starting to push back. There is a movement. And I think that nurse practitioners have a unique opportunity to be on the forefront of this because we have our pulse on the patient way more than other practices because we spend the time with them from our nursing background. What training would a nurse practitioner that's like, listen, I kind of want to buck the system from the get? Like, what training do I need before I get into this? Because, you could work at a primary care office, but the functional medicine part is pretty specific. Did you do a functional medicine course? Did you just spend time with the functional medicine doctors?
I just spent a lot of time with Dr. Reiser and now with Chelsea learning. I still learn new things every day. A lot of the testing sites, though, like Dutch testing, which is good for hormones, oat, which is organic acids, which can pretty much show you everything that you have in your body. Those diagnostic testing sites, websites have a lot of information as well. I know that our functional medicine providers are functional medicine certified. So there is a certification that goes along with that. They love what they do, loves the courses, love the learning. I also just went to a conference. We work a lot with compounding pharmacies.
Making stuff specific for genetics.
Not a one size fits all because everybody is so different. To your point about the vaccines, everybody's body is different and is going to respond to that differently. We work a lot with the compounding pharmacies, and they just allowed me to go to a conference on hormone replacement therapy that really talks about everything from bioidentical hormones to exercise and nutrition and things that we can do to just keep ourselves on the right track that, doesn't make the pharmaceutical companies millions of dollars, would cost us very little. Join a gym or go on a walk or eat the right amount of vegetables in a day. I'm just as passionate about it as you are. I think there is a shift and we really can be on the forefront of that shift. We are more bedside, appropriate by nature, I feel like. We just have a different outlook typically on patient care than our predecessors did.
Yeah, I agree. I think that the world is moving in that way. And I think that's how direct primary care can be on the forefront of that. We can disrupt the insurance companies. Somebody's getting rich somewhere. And unfortunately, it's not the people. Somebody's getting rich somewhere. And
Well, it's not. I mean, look at United Healthcare. They made $8 billion and 8% of that went to providers. So 8% of your $8 billion goes to the people that take care of you. It's wild. I mean, people are paying hundreds and thousands of dollars a month, not using it and still getting billed because insurance is like, yeah, don't need to cover that.
yeah,
So
exactly. What I spend per month and then I still have copays. I don't even understand. Shouldn't this be included if I'm just going for this little thing or I'm going to get my skin checked or I'm going, like, I don't understand why they're just absolutely nickel and diming us. And I think I do understand why. There is a system that needs to be fed. We need to disrupt it and starve it a little bit. Intermittent fasting, I've been told, is good. So part of the beast, I think that direct primary care can really work to disrupt that system. And again, I know that you're enjoying owning your practice, being your own boss, and taking care of your patients well, and how much more of a rewarding career that is than the churn and burn of working in the hospital setting, barely taking time for your patients, dealing with all the other bureaucracy and not providing optimal care. I struggle with that in my practice. I care for patients and I'm like, I don't really feel like I'm providing you good care when I see how obese you are. And I'm just telling you that this is going to fix all your problems. I know that the care I'm providing is suboptimal. It does require a silencing of your conscience, right? Just get through the visit. And I've just gotten to the point now where every patient leaves with books. I'm like, I can't lie to you. Go read this. Like Benjamin Beekman, Why We Get Sick. And some of the patients, their wives were called. And I'm like, so what did you tell Mr. Amazon and bought 3 different books and he's reading and I'm like, perfect. Yes, I took care of this medical need that, from the FDA was approved, but then also I was like, let me arm you with knowledge because that's the only thing I can do to ameliorate my conscience. I don't have to do that, but it just makes me feel good about doing my role as a provider at my current job Tell me in your own words what it means for you to have this role as a nurse practitioner and the empowerment you feel with owning your own business.
Yeah, I think that's what we got into this field for. No one goes into nursing and then the NP world because we don't like people and we don't want to care for them to the fullest. It really is a caregiver role. I want to help everybody. It feels like I just want to do this for everyone. I want to get everybody out of this assembly line medicine. I want everybody to be able to let us take care of their health so they can worry about their jobs and their children's and their families and really live their fullest and their best life. Every day's not perfect. Some things are hard. Sometimes I don't do a good job and I regret it or I have to go back and do more. For the most part, having the autonomy to be able to practice the way I want to, not the way someone else tells me
Mm.
I have to, has just been very fulfilling. I could never go back to working in that bureaucracy. I'm so fulfilled. It makes my personal life more fulfilled. It just is a great full circle. I kind of struggled finding my identity after I received my master's and where I wanted to be and what I wanted to do. This is it. So it and then the pride, the stress, obviously, but the pride that comes with it being your own is really special.
Yeah, that's really cool. You kind of touched on it briefly, but if you could go back and do one or two things differently, if you could have said, this lesson is something that I learned that was huge for my career, what would you say is something that you would leave us with? Love this.
I really thought I had to do the hardest job possible. Well, I made work harder than it had to be, whether it was the floor that I picked in the hospital. I would come home with it. I was grumpy. I'd work 13 hours and not feel like I'd done anything. And I could feel myself just being so negative. If your job is making you feel negative and you're negative in other aspects of your life because of your job, it's not the right place. You're not giving the care that you were meant to give. I worked a lot of jobs where I was not happy and didn't feel like I was doing the right thing or doing enough. If you feel like that, there are other places you can go. The opportunities are absolutely endless for what you can do.
I love what you've come on and shared about because I had never heard of this. I've heard of it, but I didn't even know it conceptually. When you don't hear someone's journey, you don't see the physical person in front of you, when you don't feel the energy that they're giving you, it just all seems very abstract and otherworldly. But then whenever you chat with someone that's looking you dead in your face and being like, this is what I do, I'm living proof. Like, I'm not making it up. It's not some concept. It's not this far reaching thing. It's right here, right now. You know someone who's doing it. It changes the atmosphere around something and it
Mm.
makes you feel like it's doable. Like, why don't I consider this? Why haven't I thought about this? Why am I afraid of this when somebody else is doing it? So I think it is great that you came on today and shared everything that you're doing and you were so transparent. I love what I do and it's changed how I look at life overall because your work is a big part of what you do. So if you don't like it, you've got to change it and you've got the perfect degree to do something else. You don't just have a plug and play. No, you've got a myriad of options. And I love that you've showcased that today. Thank you so much, Lauren, for coming on.
Yeah, thank you. And thanks for your energy and passion too. It's great to see other people in the field that feel the same way.
So tell me where they can find you, Lauren.
So you can find us. Our website is shccarolinas.com. And that is our same Instagram tag as well. Chelsea and I do a really good job up there of giving little tidbits of information during allergy season or flu season, just little bits of information that are fun to browse through. I'm sure there's something that pertains to you.
Yeah.
And then we also, Functional Health Center of the Carolinas is also on Facebook. We are located in Fort Mill, South Carolina, and Charleston, specifically Mount Pleasant, South Carolina as well.
Very good. And for the success, I'll put all her stuff in the show notes so you can find her if you want to reach out to her. The Success MP quote for today is coming together is a beginning, keeping together is progress, and working together is success. We're all about success here. What does your career look like? What does success look like for you as a nurse practitioner? It looks different for all of us. It's not the same. And so the author of that quote is Edward Hale. I have to remember, we have to do rapid fire, Lauren. Are you ready for rapid fire?
I'll do my best.
If you had to pick an actress to play you on TV, what would it be? Who would she be? Who or he? Hopefully, we're not doing that. We're keeping the genders. Who would she be? Okay.
Kristen Bell.
I totally see that. Yeah. And then if you have to give a book to somebody, this book, this for you is what you would give to anybody that needed a book. What book would you give? Change your life. This book change your life. Maybe it
I
is.
don't read a lot of nonfiction. Atlas Shrugged. It's just a book that's like this thick. It's old, but I don't know. It's pretty political, but it examines all sides of politics, and I like it.
Love that. And for the last one, what was your very first job ever that you ever done?
I worked in a chiropractor's office when I was 16. My dad was going to see a chiropractor, and I worked in his office doing soap notes.
Colin, now
Yeah.
you're practicing step nuts. Oh my gosh. It's so fun. Thank you for your time today. Thanks for hanging out. Guys, thanks for hanging out on the Success NP podcast. Enjoy your week.
Thank you.
Thanks for tuning in to another episode of Success NP. We hope today's discussion has shed some light on the diverse career options or taught you how to improve your clinical practice as a nurse practitioner.
Remember, whether you're considering a specialization, pursuing advanced certifications, or exploring non-traditional roles, there's a wealth of opportunities out there waiting for you. Be sure to subscribe to the show so you don't miss an episode and leave us a 5-star review. It helps the podcast grow. The Success and Peace podcast is on the World Wide Web, YouTube, Instagram, Facebook, and X. So subscribe to our newsletter for updates on new podcast episodes and other information to help you on your own NP journey. You can always message us at successnpspodcast@gmail.com with any NP podcast episodes or topics you'd like us to discuss.
Until next time, take care. Stay curious and keep advancing your careers as a nurse practitioner. And just a friendly reminder, the information on this podcast is for educational purposes only. The information should not be used in substitute for professional care by a medical provider. The information on this podcast does not represent medical or professional advice or services.
Bye for now.